Myocarditis simply means heart muscle inflammation. So what happens is that when there is inflammation in the heart muscle, it will not be able to contract properly, because inflammation has all other sorts of sequelae which will definitely compromise the contractile function of the heart. So majority of the cases of myocarditis resolve without any serious complications, but if it heals by fibrosis in some cases, then there will be definitely the compliance of the heart will decrease. It will not be able to contract or relax properly. So usually the clinical symptoms are spread on a large spectrum. It can be entirely asymptomatic, or it can also lead to arrhythmias, congestive heart failure, or sudden cardiac death due to these arrhythmias. It is a relatively short topic. The most important thing to remember here is the etiologies. First of all, the etiology can be a viral infection. Most cases in the US are viral in origin. These can be due to Coxsackie virus A and B and echovirus. The cardiac involvement in this case can occur in days or weeks after the primary infection. So the damage or the inflammation caused to the heart can be directly due to the viral infection or immunologic hyperreactivity or cross-reactivity. The second agent to cause myocarditis is Trypanosoma cruzi, the organism that is responsible for Chagas disease. So myocarditis is one of the symptoms of Chagas disease. Thirdly, we can have in diphtheria, the Corynebacterium diphtheriae toxin can also cause myocarditis. In Lyme disease, that is caused by Borrelia burgdorferi, we can also have myocarditis. It is usually mild and reversible. We can have myocarditis in AIDS. This can happen due to, since it is an immunodeficiency state, another organism can also attack the body and cause myocarditis. And also the AIDS virus can directly also affect the heart and cause the myocarditis. Some non-infectious causes of myocarditis are also there. They can be immune mediated, that is associated with rheumatic fever or SLE or drug allergies. The drug allergies will involve eosinophilic infiltration mostly, that causes great damage to the heart muscles. And in some cases, the causes can be unknown, and mostly what happens is that we cannot know what the cause is, but we can detect giant cells in the myocardium. Giant cells are macrophages which fuse together and form one big giant cell with multiple nuclei. We can find them in the myocardial cells, but we do not really know the etiology. The signs and symptoms and complications of myocarditis are simple because it is inflammation. It can disrupt the conduction pathways, causing arrhythmias. The patients usually have a positional chest pain. That is, when they change positions, they have chest pain. Fatigue, fever, and shortness of breath is a complication, and in severe cases, we're going to have heart failure, and thus heart failure signs will be there. That's all about myocarditis.